I've taken out a cystic mass that was 40 pounds.
Welcome to a very special episode of Stuck in Vermont, brought to you by 7 Days. My name's Ava Sahlberger, and would you like to know what this is? Well, it's a melon, but it's also approximately the size of an ovarian cyst that was growing inside of me. I'm making this video to educate other women about ovarian cysts. When I found out that I had a gigantic mass on my ovary, I didn't know the first thing about ovarian cysts. Since then, almost every woman I've talked to has either had one themselves or they know
their mothers or their sisters or even themselves had experiences with ovarian cysts.
I think there's a stigma related to women talking about any of their reproductive organs.
Just became aware of how common it was, but yet it seemed like this secret.
What is it about ovarian cysts? Why do they even exist at all? Was there something wrong with me? And how do you know if this cyst is turning into ovarian cancer?
If you have a cyst that's just completely a balloon filled with water with no lumps and bumps in there, majority of the time, if not close to 100% of the time, it is not cancer. That may not be something that you need to worry about. And some of them are functional. For example, when you ovulate once a month, you can have a cyst that develops. No woman should ever feel that just because they have a cyst on the ovary that they are quote unquote abnormal.
Cysts happen, but it's important for you to be educated about the steps that you need to take if a cyst happens to you. So I went to my doctor and I said, I really have a feeling something is going on in my body. And she said, no, you're fine. So months later, in June, I woke up one morning to intense, excruciating pain in the left side of my abdomen. I was nauseous, I was sweating, I felt like I was gonna pass out any second. They tested around my abdomen for signs of a ruptured cyst or a ruptured appendix, and neither one seemed to be the case. So for $1,200, I left the ER with no diagnosis whatsoever. On and off, in the following weeks, I had intermittent pain, and the only thing that saved me during that time was this, my hot water bottle. I walked around with this fish in my pants for weeks. So after 3 pelvic exams, which turned up nothing, I eventually did get an ultrasound, and that was only because the pain was not going away. So after I had the ultrasound, I found out from my doctor that I had a large mass on my ovary. They thought it was my right ovary, but I knew deep inside that it was my left ovary. They decided this was not a simple cyst, this was a complex cyst. I knew I had something big growing inside of me, and I knew that it could be cancerous.
When we say someone has a complex cyst, it means that that ovary has a cystic component, there is a fluid component to it, and there's a complex, which is a solid component. So complex cystic mass are the ones that are a little bit more concerning.
So I went into the ER, and initially the thought was that they thought I was having appendicitis. It kind of felt like an afterthought that they thought maybe it would be an ovarian cyst, and I was taken to have an ultrasound. Ding ding, you know, it's an ovarian cyst. From the scar tissue, they told me it was probably about the size of a clementine, which just was shocking to me that I could have something that large inside my body and not know.
Cyst is like a balloon filled with water, and at some point it's going to get weak, so it leaks. But no one really knows why a cyst will rupture. And sometimes a cyst will rupture, and then the body will heal over that little rupture, so the cyst will continue to grow again.
When I was in college, I had a cyst on my ovary and it burst. The pain was so intense that I went to the emergency room. The reason that my stomach was swelling was in fact because of the fluids that were inside of the cyst.
In laparoscopy, we are operating with a telescope, and we're looking at TV screens. It's like operating with chopsticks because your hands are out here, the belly is in the middle, your fingers are manipulating instruments. It's the Da Vinci assisted laparoscopy. We have 3D vision. I am able to move the arms of my instruments much better. We can do it the quote unquote old-fashioned way where we make an incision on your belly.
This was 21 years ago. She said, I have found quite a large mass in your abdomen. It's about the size of a grapefruit. In those days, it was major surgery. I was in the hospital for 3 days. That long incision cuts all the abdominal muscles. Longest recovery, it was 3 months. And sure enough, after the surgery, that's the first thing they tell you. Yes, it's benign. It's not cancer. Of course, that was a big relief.
So in August, Dr. Wong performed a Da Vinci-assisted laparoscopy on me. Luckily for me, it's a relatively non-invasive surgery. They only do 5 small incisions, and the recovery time is pretty fast. I actually had to sign a piece of paper before I went into surgery saying that Dr. Wong could take everything out of me. For all you know, you're gonna wake up with nothing left down there. So what you're looking at now is the inside of me. That's right, that's what I look like in there. So when Dr. Wong cut me open, he found out that this gigantic tumor had twisted my left fallopian tube. And guess what? I was right. It was on my left side. It turns out that I have endometriosis. That means it's a chocolate cyst. So when you cut it open, it looks like chocolate, only not as tasty. My left fallopian tube, my left ovary, and the gigantic cystic mass were all removed. They were drained of their fluid, put in a plastic bag, and then sacked through my belly button. Bye-bye. I could say that I'll miss you, but I would be lying. When I woke up from surgery, the first thing Dr. Wong said to me is, "You don't have cancer."
A patient wants 100% diagnosis of whether or not they have cancer or not. The only way that you can do it is by surgery. So we would take out an ovary or a portion of the ovary, send it to the pathologist, and they'll do a biopsy on it and tell us. No one knows what is the cause of ovarian cancer because majority of the women who have ovarian cancer have no family history, no risk factors. I have patients who eat healthy, exercise, don't smoke, don't drink, and very, very athletic, and they still develop ovarian cancer. So no one really knows why. Women who have ovarian cancer are symptomatic. They complain of pelvic pressure, urinary symptoms, they may have constipation, early satiety. And the reason why ovarian cancer is considered deadly is because most women who present to us with ovarian cancer, over 80 to 90% of these patients already have cancer that has spread out of the ovaries to other parts of the body. And if we pick up ovarian cancer very early, if you do the appropriate surgery, these patients may not need chemotherapy, may not need radiation therapy, and they have an excellent prognosis.
So now I only have 1 ovary and 1 fallopian tube. I was one of the lucky ones. So here's what I learned from my massive ovarian cyst, because you have to learn a lesson from it, right? I know my body better than anyone. Trust yourself. If your doctor doesn't listen to what you're telling them, go to another doctor. Don't skimp on your health.
It's very important for patients to be their own advocate.
My health is up to me.
You know your body best.
Cysts happen, but luckily there are some amazing doctors, OBGYNs, and surgeons out there who can figure out with us what the next step is to make sure that we're healthy, fit, and gonna live a long time. We'll get sick and out with you again real soon. Smells right. I think it's time for me to eat this melon cyst.
How many surgeries do you feel or think about you've maybe performed?
Oh my goodness, hundreds. I mean, I've been here for 10 years, and I operate anywhere from 2-3 times a week. So
Are you very careful with your hands?
I am, yes. So I do not do any power tools. I am not allowed to deal with power tools.